Good afternoon, everyone. We are back again today to share with you what is happening in Eau Claire County related to COVID-19, to give you an update, and today to share from one of our frontline people a little bit more about what happens when we get a positive COVID-19 case in our community, and really in every community, the public health follow-up and response to individual cases of disease and how we do that. So we hope that we can answer some questions to give some perspective to people about what's going on, and we're glad people are paying attention and listening. So today, to just give a quick update, in Wisconsin there are 707 positive cases of COVID-19 that we know through testing, and 8 deaths. More than 11,583 negative tests at the state level. Again, as I said yesterday, Wisconsin is considered a state where there's community spread. So we know that while there are 707 positive cases from testing, there are likely many, many more people that do have COVID-19 in Wisconsin, as well as the rest of the nation. In Eau Claire, we now have 7 positive cases, and as of yesterday, 402 total tests with 277 negative tests. Again, 1 new positive COVID-19 by testing today. A reminder that as we do that testing, that we make sure that contacts stay home, and Paulette will be talking a little bit more about that. But the spread of COVID-19 to contacts of people that are positive is something that's critically important during this time. As we all know, the order started yesterday morning at 8 o'clock for everybody to really follow a stay-at-home order for the state of Wisconsin. We've gotten a lot of questions about that. I know that those questions have come in all different ways. I'll try and answer some of those questions. Again, a reminder that the stay-at-home order is in place to really work on flattening the curve. That's something that we've talked a lot about, but the idea is that we would have fewer people sick at the same time if we can decrease the number of people that any one of us comes in contact with and potentially spreads the disease. Our goal in flattening the curve and in this order is not to eliminate disease entirely. We will not see tomorrow that all of a sudden we don't have new COVID-19 cases. Over time, the weeks that we have in the order, we hope to see a flattening of the number of cases and eventually not having new cases. So I think for everybody to understand that as I come back to you day after day with the count of cases in Wisconsin and in Eau Claire, that the order is not going to magically change that we will continue to see cases, and that this order over time will hopefully make those flatten out. So a couple of the questions that we've gotten that I'll just address now, and certainly we can respond to additional questions. Travel has been one that we continually get people asking about, and I know statewide there are questions about that. Again, there's no requirement for essential travel to carry any paperwork with you. So that question does continue to arise. And again, there's no requirement in the order for anybody to carry any kind of paperwork to say that what I'm doing as I'm traveling is related to essential work. We also had a question yesterday, particularly related to travel to places where we can move and exercise, parks, state parks and local parks. And it is allowable as part of the order to get in your car if you need to do that, to travel to a place like that. Again, in doing that, the expectation is that in order to make sure that we are staying within the boundaries of the stay-at-home order, that we are doing that with our people that live in our household. We are not meeting friends and broad community members that are connected to us in those places that are outside, but that we are going to those places with people in our household. We also want people to know that if you are deciding to travel someplace or go someplace to get outside, we think that's a wonderful thing, that if you're going by yourself, to let someone know so that if anything happens to you while you are out and about, that someone knows that you are out, and keep an eye on each other when you're doing that. We've also gotten many questions related to what is an essential service and what are we doing about making sure that, first of all, those essential services are safe and healthy for all of us, including the people that work there. And what about those places that are not following the order, that are both essential service places and ones that are not deemed essential? A couple of comments about that. So elections is a critical function that happens every year. It happens that it's going on right now while we have this order in place. That is a priority in Eau Claire County. We have Incident Command, the group of people that I talked about yesterday, working on that with our partners. We are expecting state language very soon. They told me on a call a few minutes ago that it was on its way shortly, really giving guidance about how to make poll workers safe and those poll sites safe. So we are expecting that soon, and we'll be working with our team to get that information out. Again, physical distance is our best strategy, along with washing hands. We do want people to vote. We hope they take time to vote, either in person, but preferably if they can absentee vote. Workplaces are also a place where we want to make sure people stay safe that are there. We are getting some questions from people that are in essential work sites that are concerned about their safety as workers. Certainly, we encourage people to talk to their employer first about physical distance, about staying home if you're sick, all of those measures. If people are in situations where they don't see the response that they are hoping for, that they think is following the order, please call our COVID call center and we will address those questions. Again, the call center number, 715-831-7425. People can also go to the WEDC website, WEDC website. They have all the essential businesses listed there. They are the place where if you think you're an essential business, they can take that inquiry and work with the organization to see if it is. The Chamber is also getting a lot of information out about businesses and how to support health and safety. Our team yesterday worked on a communication for all businesses that we are getting out that includes posters for walls, that includes clear communication about addressing risk, and we are getting that out, hoping to cover businesses across Eau Claire County with some good, solid, basic information and an opportunity to ask questions if they have that. We are also getting questions outside of the order around testing and healthcare preparedness. Again, testing is happening in Eau Claire County. As you heard me say earlier, the number of tests increase. There is an attempt across the state to prioritize testing for the highest risk populations. Again, that's healthcare workers and those with significant symptoms. We know that means that people that have minor symptoms may not be getting tested. We understand right now that testing supplies are available in Eau Claire, and we have not heard that there's a specific concern about that issue. Healthcare preparedness is critical, though. If you've watched any of the international news, you know that it's critically important that if and when we get a large number of people that need services at a healthcare institution because of significant and dramatic symptoms, we need capacity to do that. We are working with our hospital preparedness partners across the region to identify the resources that we have and get them out. So there's a team that is collecting supplies and resources, as well as getting those out to those critical healthcare responders and first responders. Again, that's part of the work we do in a pandemic like this and is part of our plan. And we're working hard so that if we don't have success with this order flattening the curve the way we want it to, that we're prepared for healthcare being able to respond. The biggest thing that we can all do, though, so that we don't have to have the kind of healthcare capacity that we've seen in some countries in Europe and in China, is that we follow the order. We stay home to help flatten that curve. That's what healthcare needs from us right now, and that's really why we have that order in place. We'll need less healthcare, emergency services, if we stay home. We also have gotten some questions, and I want to talk a little bit about what we're doing for the populations in our community that may have additional need for support. We have a task force working on the homeless population, or the population that's experiencing homelessness right now, and there is some significant work happening to make sure that their sheltering options are safe. They have physical distance, and we are working to assure that. I believe that will be up and running yet this week. We are also working to make sure that those people that don't have English as a first language are getting the materials and resources. Those posters and the things that you've seen us share are getting translated. We are also pulling in information from the federal government as well as the state government that are translated resources. Our daily webcasts, we've been really fortunate to work with Valley Media Works and having those closed captioned for people that are able to follow by using that kind of a resource as well, and we appreciate that. We would like to share a little bit more. Some of those things I shared with you are what we've been doing in Incident Command the last couple of days. But do know that that's where we get the work done, that Incident Command structure that I talked about yesterday. They're following up on the 90-plus calls that came into the call center yesterday. They're following up on the 7 cases that we have and making sure that people are staying healthy and safe and not causing infection to happen across the community. We are also working these last couple of days a lot on the order, so you can imagine that with our legal team, with our team that's out on the call centers, and that work is happening. We today and in the last couple of weeks, as I've said earlier, are identifying places that we might need to use if we need overflow for healthcare, if we need places for people that don't have another option for isolation and quarantine. Again, that's the kind of work that we've been doing to respond as needs arise and plan for the future if things get worse. We also know that there are funding streams coming forward from the state and federal government, so we have a team that's working on how to best support that. And we have a team that's working on the precious resources that we have for personal protective equipment, things like masks and ventilators. There's a team that is working with all of our healthcare partners and first responders to get materials out to them and identify what additional needs there are. We do, as you heard from Dale Peters yesterday talking about the role of connecting with government, we know that our rural areas and some of the areas in our community may not have the same resources that we have in some of our larger communities. So we are also making an effort to make sure that information and connection is happening across our county, critically important, and that all people that are responding stay safe. You've seen our public information work. This campaign that we have that is getting out with our posters, the webcasts that we're doing with all of you, the media casts, and going on our website. Those are all ways we're getting information out and continue to do that. So today I'm going to have Paulette Mager share with you a little bit about how we do investigation of disease, and then after that I'll come back and can answer some questions.
Although COVID-19 is a new disease, communicable disease follow-up is not something new to us. We do communicable disease follow-up on an almost daily basis. We are very good at this and know what we're doing. We stay current on all state and federal rules around COVID-19 follow-up and use those to curb the spread of illness. First, let me explain some of the terms you might be hearing in regards to COVID-19. Safer at home, our governor's orders, means that healthy people are the only ones who should be traveling out and about for essential needs and work. This will greatly reduce any potential exposure you may have to COVID-19 and greatly reduce any spread. Isolation means when someone is sick, they are asked to stay home and away from others. This is where people who are tested fall into prior to them getting their test results back, and those who are positive fall in. Quarantine is when someone who is not sick is asked to stay home because they have been in contact with someone who is ill or who has been potentially in contact with someone who is ill. This way here we also have the chance of making sure that when that person gets sick, if they do get sick, they have not exposed other people. These are all very important things to do and all need to be taken seriously. The law requires that COVID-19 cases are reported by the healthcare provider to the health department. Once we get a case reported to us, we will contact that individual who is positive within hours. Normally, the healthcare provider has already told this person that they are positive, but if not, we will let them know. We will then ask this individual a series of questions. These questions will include, where have you been in the last 14 days? Have you traveled? Have you been around someone who has been ill and diagnosed with COVID-19? Who have you been in contact with since you've been ill and the 2 days prior to you getting ill? What are the symptoms that you're having and when did those symptoms start? We ask these questions to understand where this person may have gotten this illness and who potentially they may have spread this illness to. So far in Eau Claire County, all of the cases that we have as positives have known where they've gotten the illness, so there's no community spread that we're aware of. Once we get the names of the contacts and the contact information of the person who this individual may have been in contact with, we start to notify those individuals, and then we quarantine them for 14 days. If the individual is a household contact to the positive person, then the person may have to be quarantined longer. We need to make sure that that quarantine starts not only while they're with that person, but then also as long as that person's contagious. The 14 days will start afterwards. How do we know if someone is a close contact? These are normally friends, family workers, or coworkers, other people that this positive individual has been in contact with in the last 2 days before they were ill. The definition of a close contact is 6 feet for at least 10 minutes to this individual. Again, we get in contact with these individuals who are contacts and quarantine them for 14 days. We ask them to monitor themselves for symptoms, and if they do develop symptoms, to notify their healthcare provider or the health department that they're having those symptoms. If they do need to go in to see a healthcare provider, we ask that they notify the healthcare provider that they have been in contact with someone who's COVID positive, and therefore the healthcare providers can take the necessary precautions to not spread this disease. The health department will monitor the ill person for the entire time that they are on isolation. We will monitor their symptoms. They will be on isolation for 7 days and 72 hours after the last symptom has ended. So they, in fact, might be on isolation for greater than 7 days. The health department will release that individual from isolation so that they will know when they can be freely going about our community. Thank you.
We're really fortunate in Eau Claire County to have such an amazing communicable disease team, and Paulette leads that team, and we are very fortunate as a community to have that kind of expertise here. Do know that every local health department in the state of Wisconsin has people doing this work. It's part of the mandate that we have. We are required to do communicable disease follow-up. Certainly none of us expected that this would be happening, and so we are, our team is working hard, as is every other health department team across the state, including the state health department. Lots of work, but critical work. We want to make sure that those people that are ill understand what they need to do, and those people that have been in close contact with those that are ill. So thank you, Paulette, and we certainly will, if there are additional questions, we can address those. I do want to remind everybody that this is hard. It is unprecedented. For those of us that have long been in the world of public health and communicable disease, I don't think all of us thought that there would be another pandemic of some kind, but this is really unprecedented. We've only had one full day of the order. We're in our second day, and we know that that's going to be difficult for people as well. I'm lucky I live a block away from my work site, and I walked home for a little 10-minute break, and my daughter turned on the music loud, and we danced in the kitchen. So people take time to find those little mental health breaks and use them. Even those people that are on the front lines responding and are working lots of hours to be making Eau Claire safer, take those little minutes to do that. Our dog didn't like it very much, but we had fun dancing around the kitchen. It is hard that we're also going to see more people that are ill, and we may also have deaths in this community like we're seeing across the state, and we know that that's difficult. We will continue to come back and talk to you every day during the week as we have updates. We have the commitment to do that with everyone and to share with you what we know to prevent the disease from spreading further. So again, go to our website. That is a good resource for you to get current information. And I think everybody knows that at this point, but coronavirus.echealthdepartment.org. We have the new call center line, and that number is 715-831-7425. The old number will work, but please use that new number so you get a quicker response. We'll continue this update daily, and now we're available for questions. Yes?
So one question, what should people do if their workplace is not, if they feel that their workplace is not doing enough to protect them from COVID-19?
Yeah. So the question is, what should people do if they don't feel their workplace is doing enough to protect them against COVID-19? Again, I would say that for those people that have to be working in an essential service, we count on them. We also count on them being healthy, and we count on their employers understanding that if they have sick employees, that it's not going to help anybody. It won't help their business, and it certainly won't help their community. If a conversation with the employer is not working, we encourage people to call the COVID-19 line, and we will respond to that. Yes.
We got a call from a community member saying that their daughter had recently returned from an area over in Spain, which is one of the the hotbeds for this. Started exhibiting symptoms, went to get checked, and the hospital would not consider them a high enough risk because they're younger, and now they're exhibiting more and more of the symptoms. They were just basically told to quarantine themselves for 14 days, but they would not test them. Mm-hmm. How bad does it have to get for a person before they're tested, and is it possible that there's people that won't be tested that have this, and it could be, skewing the numbers a bit from what's actually positive in the county?
Sure. So the question really was related to what's happening with testing. What about people that are not getting a test, and how does that skew potentially the numbers of COVID positive people in any community? And what do we know about testing? I don't know the specific situation that was mentioned related to an individual with potential interest in being tested. Testing is happening across the community. The tests that are going to State Lab of Hygiene and are being prioritized, again, are the tests that are for healthcare workers and those with significant symptoms. Other healthcare providers are testing others. We know that that is happening, and that is not inappropriate, but definitely we want to first prioritize capacity for those highest risk individuals. If someone is having worsening symptoms, if someone is concerned, they should touch base with their healthcare provider and talk that through with them. If there are additional questions, calling the COVID-19 hotline is certainly an answer, and it is really important that we have people doing that if they're concerned. Again, having a test done doesn't necessarily tell us what disease looks like in Eau Claire County. We have tests. We know that there is disease in this community. That is true across the state. Our advice for sick people is to stay home. That it is critically important, and we are doing that here at the courthouse. We're sending people home if they're not remembering to do that, and we say that to everybody. So the most important way we stop the spread of disease is to make sure that people stay home when they are ill. This is not a disease that we have a medication for. People won't be able to go to the hospital to get treatment if they have low-level symptoms. Hospitalization is for those severe symptoms that can't be managed at home. So again, our hospital resources, certainly we're testing those that are importantly needing to be tested, and there's a broad range of people that are being tested across the county. And the hospitalization resources are really for those that can't manage illness at home. We know, as I said earlier, that there are people in this community that are not getting tested. Very low risk. We're telling them when we know about them to stay home and self-isolate. We need that to happen at this point. That's part of the stay-at-home order as well.
Could I follow real quick? If a person exhibits the symptoms, told to stay home, and they happen to live with someone who might be more immune deficient but haven't started showing the symptoms, what would you recommend in that situation?
Sure. I'm going to have Paulette answer because I think these are the kinds of questions that her team gets every single day.
So the question was, if someone was sick with COVID-19 and they did not get tested, and yet they're living with someone who might be at high risk because of being immunocompromised, we would ask that individual to stay away from that individual. So the positive person, the person who's sick, not being positive tested but sick, would try to stay away from other people, even if they're not immunocompromised, so we can curb this illness. You know, if they could be in a bedroom away from other people, wash their hands frequently, cover their cough, use a separate bathroom if possible, not share utensils, all those normal types of things to decrease illness, and therefore hopefully that individual who's immunocompromised does not get sick. If they do, they should be consulting their physician to find out what they should be doing, since they are likely to be a little bit more potentially sick than other people.
So I think it's important to understand that, again, our management tools of this disease are really such that we are assuming illness if we're seeing symptoms and advising people to not spread. And that, frankly, should and could be true for all points in time, whatever the disease is. If you are a parent, you know that if your child gets a disease in school or daycare, it often runs through the family. And that's because, frankly, we're not washing our hands enough typically. So this case, significant. We have to take it very, very seriously, but it is the principles of all ways that we prevent disease progression. Other questions? Yes.
Follow up probably for Paulette.
Yeah.
You said the health department monitors the people who have positive cases every day. Is that done in person, over the phone? How does that work?
We do. The question was, do we monitor people who are ill, who have been a positive case? Yes, we call them every day. Therefore, if they are ill, we want to know how ill they are, because we do know that some people get more ill. We can help them when they should be going out to the doctor. The other thing is we want to make sure, when are their symptoms starting to go away? When are they done with those symptoms? So then we can start that 72 hours to therefore know when the isolation should be ended. It also gives them a chance to let us know if there's anybody else that they were in contact with that they forgot to notify us the first time, so that we can also notify that potential contact that they need to be quarantined to help curb this illness.
Sort of a follow-up. Can you provide an update on the 7 people who have tested positive? Like, what's their condition?
I can let you know that they're all at home. Otherwise, we do not share information regarding our contacts or our individuals that are positive, just to protect their privacy.
I have a question, actually. That does involve both of you, but I think at least the first. Just because I've been here 7 straight days, I think some of the others have been here longer.
Yeah.
I'm impressed with your empathy for the public, but also just your even keel nature. I was just curious in terms of if you could talk about this leadership challenge, what's prepared you, what helps you maintain that, which it seems is helpful because the emotions can vary for everybody, so it's really helpful if the incident commander is even. And I'd be interested for Paulette to just comment on being a part of the team that you're heading up.
Sure. So the question is, this is a big incident. How do we keep an even keel? How in leadership do we work to make that happen? I'll tell you that I work to make it happen by having an absolutely amazing team of people to work with. I happen to be the one that stands in front of you, but this work does not happen just by me standing here and getting things done. I interestingly got a text message today from someone that said, "Thanks so much for coming out to our house on Saturday." Well, I wasn't the one that went out to the house on Saturday. My name happened to be on a letter that they got to stay home because they were a COVID positive person, but I wasn't the one that was doing that work. And we have an amazing team of people. Those are health department people, but they are also critically importantly people across our government sector that are now working with us on this response. We couldn't do it alone at the health department, and we have many, many players helping us. I also personally have been in public health a long time, so that helps me with this. And I've got a super supportive family. So I think that's one of the things that I count on every day is a touch point of that. And very frankly, I get out and walk the dog and do a lot of thinking. So yes, very long days. We are working, one of the things that we're trying to work on right now is we can't afford to have our key people that are working on this get sick or are exhausted. So how do we support each other to make sure that we've got a management of that? It's certainly been a number of weeks now of long days, and that is true, and we're working on it.
Paulette, I'd be interested just your vantage point being a key part of the team.
I would have to say the same thing. We have an amazing team, both the health department team as well as those outside people who are supporting us right now. We have a lot of experience in our team, and so everyone is supporting each other and also trying to make each other laugh, trying to recognize when things are getting a little bit rough, try to take the heat off of somebody who might be having a little bit harder day, and then going home trying to have that time to rejuvenate also. And every once in a while, a friend gave me flowers. That was awesome. There's been some area florists here who gave us flowers. We've had treats from people. All those little things make so much of a difference to help support each other, help support our team. But again, it's the amazing team, both above and below me, that helps make it better.
Other questions? Yes.
You mentioned potential overflow areas. What are some of the buildings that you're considering for that?
So we have a very long list. I'm sorry, the question was what about overflow? So there are lots of reasons in a large pandemic situation like this that the state, as well as we locally, are thinking about the potential need for buildings. So our team has identified all kinds of buildings. We are actually working with one, again, as I said earlier, related to homeless shelters, so we have a larger space for that. And the state team is working today with our group because Eau Claire is one of those places where a regional hub, so we may be a place where there is a need for overflow. And those facilities, again, nothing right now lined up specifically, but we have a long list. And I think people can imagine the types of both governmental buildings as well as buildings in the private sector that would be considered. And frankly, we really appreciate the willingness of partners to work with us to respond to this. It's been enormously helpful. It's hard. Everybody worries about their places, but it makes an enormous difference when we are able to have conversations with partners across the community, both public and private, about the need. Other questions? Yeah.
One more. So there's been a common thing to call your healthcare provider. What if someone doesn't have a main healthcare provider? What should they do?
Sure. So the question is, call your healthcare provider is something that we regularly say to people as they potentially have symptoms, as they are concerned about a potential exposure. If an individual does not have a healthcare provider, if that is something that they don't have in their world right now, certainly call the COVID-19 call center. We will talk them through options. And we know that that's the situation for some people. We do also hope people work hard to find a primary provider for lots of reasons. And if that's something that needs support, there is certainly a variety of avenues to get people linked to a healthcare provider. So thank you, everybody. We really appreciate, again, you joining us. Tomorrow we will be back and give you an update at that point in time. And we appreciate everybody paying attention to this issue and staying at home when they're able to. Staying at home if you're not part of an essential service, and protecting all of the rest of us that are working hard to respond to this. Thank you.